Good morning, ma.
Good morning, Doc. Doc, please, are you the anesthetist?
Yes, I'm the anesthetist. How are you today?
I'm fine. Well done. Young Doc.
We're actually about to have a chat with you about the surgery.
Doctor, don't worry. I've Googled everything. I've learned so much. I just have one question to ask, Doctor.
Feel free to ask the question.
Doctor, what type of anesthesia are you going to give me, please?
Well, actually, we could give you general anesthesia, regional anesthesia, and maybe at the end, we could give you local anesthesia around the area. Why the long face?
Nothing, Doc, nothing. It's just that you didn't mention the type I want. You know, my best friend, she had the same surgery. And she said the anesthetist gave her the foreign anesthesia, doctor. That's the one I want, foreign.
Foreign?
Yes, doc.
Can you describe it for me?
Um, she said the only thing she remembers actually is, before she went to sleep, the anesthetist brought the injection. It was the foreign injection, white, like the white man's skin. And then once they gave her the injection, she fell asleep and started dreaming of herself in the white man's land, doc. That's the type I want. Foreign anesthesia, doctor. Welcome back to Secret Learner's Corner, the space for out-of-school learning opportunities. Today we'll be looking at the pre-op phase of the perioperative period. This phase starts from when an individual agrees to have an elective surgery and starts planning it up until induction of anesthesia. Anesthesia simply means loss of sensation, and when the sensation lost is the general body sensation including loss of consciousness, then that is general anesthesia. When is limited to an area of the body, such as from your waist downwards or one of your arms or one of your legs, it becomes regional anesthesia. On the other hand, if local anesthetic injection is given in a little area such as one eye, or probably you're going to have a breast surgery to take out a breast lump, and then the local anesthetic is given around that lump to take it out, it becomes local anesthesia. Now, one could have one or the other, or it could be a combination of two or even three of the different types of anesthesia. So you can see there is no place for foreign anesthesia. My name is Ugo Nachukumaife, and for those who don't know me, I'm an anesthetist and a peri-op physician. So let's go back to the pre-op phase. Like I said in my first episode, this is likened to running a marathon. How do you prepare your body to run in this marathon? Now, the important thing about general anesthesia is that it reduces the function of most of your organs and systems to about 30%. So you can imagine if you're operating at 50% and then the anesthesia comes and takes away 30%, you only have 20% left. And there is no way you could go through that anesthesia and have an effective and quick recovery functioning at 20%. However, if you're operating at about 100 or even 120, if 30% is taken away, then you have, something reasonable to fall, and that is to say that you have a good reserve. So the important point in the pre-op phase is to build up your reserve. And how do you do this? We'll look at the different systems. Let's take the heart and the lungs. They work together. The heart pumps blood to the rest of the body, and that blood has to be loaded with oxygen. The lungs loads the blood with oxygen, and for it to be able to do this job, it needs blood supply. So how do you build up your reserve? First of all, you need to be aware of your underlying health conditions. I can't tell you how many new diseases we have detected in individuals during the pre-op visit. And these individuals don't even know that they're suffering from this heart disease or the lung disease until we meet them. So if you're planning on having an elective surgery, please ensure you go for a health check where, your doctor or your GP will run tests, examine you, and ensure you're all right. And if there is anything underlying, it will be detected and it will be managed. The fact that you have a disease does not disqualify you from having a surgery. And if you know about any health condition, ensure that it is well controlled. You're compliant with your medication and your appointment, and that you let your surgeon know. Because if your surgeon knows, then he or she will highlight it to the anesthetist, who may decide to see you much earlier on before your surgery, and so to take Other precautions. Assuming you don't have any health condition or that your health condition is well controlled, you still need to build up your reserve. Get fit. Eat healthy food. That is not the time to be eating unhealthy diets that could clog up your blood vessels. Drop some unhealthy habits such as smoking, taking alcohol. These on their own create a problem and they increase the risk of anesthesia, especially to the cardiovascular system and your respiratory system. Now let's look at your kidneys. Your kidneys can also take a hit. If you have any kidney disease, please make sure it is well controlled. Some people who are on dialysis still come for surgery, and that surgery is safe. The important thing is that whatever illness you have is well controlled. And if you don't have any illness, build up your reserve. Ensure you're keeping well hydrated. Avoid things that are toxic. I've already mentioned alcohol. Some medications are best avoided because they can be toxic to your kidneys. Some diets as well. If you're taking some recreational medications, it is better to stay away as long as possible before your surgery. Looking at your immune system, anesthesia increases the risk of infection, and you're going to have surgery. We're going to be opening up parts of your body. That increases the risk of infection as well. So maintain hygienic practices. You want to make sure you're having your bath twice daily, weeks before that surgery. You want to keep a good oral hygiene. Oral hygiene is so important because anesthetists play around your mouth a lot, and that is the entrance to your lungs. So if you have a bad dental hygiene, then there is a chance that you could develop a chest infection during or even after the surgery. So ensure you're brushing your teeth twice daily. And there are some antibacterial mouthwashes. I also recommend you use that to ensure that you have a good dental hygiene. Avoid sweets, chocolates, and sugary drinks. This increases the risk of dental caries. We would like to know if you have loose dentures. There are people who have swallowed artificial dentures or even loose teeth under anesthesia. This is quite risky. So if you have any wobbly tooth or if you have any artificial denture that is removable, we need to know so that we can be cautious about it. The next thing I want to talk about is your size and your shape. Being overweight can create a problem for you, for the surgeon, and for the anesthetist. So if you have time, please get into the right size and shape. The bed we use for surgery is not even a bed. It's a table, a narrow table. So you need to be able to fit into it. There are a lot of things that are dependent on your size. And if you don't find the right fit for you, it can become a problem. Being overweight can also increase risks of so many things. And so, if that surgery is not life-saving or life-threatening, if it's not cancer-related, if it's not related to a trauma such as you broke a leg or a bone and you needed fixing, and if it is not acute, for instance, if you have an acute appendicitis that needs to be taken out or an acute gallbladder that needs to be taken out, then that surgery can wait. It can be an elective surgery. An elective surgery simply means that surgery is planned to suit the patient, suit the surgeon, suit the anesthetist, and also to suit the facilities going to be done. So it's important that you're able to get well prepared. Now I'm going to leave you with this. Delaying that surgery will not kill you, but exposing yourself to anesthesia unprepared can kill you. Now, if you want to have a tour into an operating theatre suite, then don't miss our next episode where I'll be taking you through a typical day at work as an anesthetist. Remember to leave your stories on our page, Secret Learners. We are on Facebook, Instagram, and YouTube. Stay tuned. Thank you very much.